guys, this is Dr. Hub. Today we are going to compare the child airway versus that of the adult. To begin with, we first go with the position, and now we are just focusing on the child. So here the position of the child will be opposite to that of the C3 as well as C4. And what about the epiglottis? The epiglottis is nothing but it is omega shaped. Then the thyroid cartilage, it is flat. What about the larynx? The larynx, if you see, it is conical in shape. It is conical in shape. Then comes what is the most narrow part in case of the child. So looking at the narrow part, the most narrow will be that of the subglottis. It will be the subglottis. And looking at the submucosal tissue. So what about the submucosal tissue? So the submucosal tissue, it nothing but it includes a more and loose. Then comes the lateral cartilage, laryngeal cartilage. So laryngeal cartilage, it is a soft and collapsible. Now we'll move on to that of the adults. So in case of the adults, the position is opposite to the C5 as well as the C6. Then comes the epiglottis. So what about the epiglottis? So here the epiglottis, it will be leaf shaped. It is leaf. This is in case of the adults, it is leaf shaped. Then what about the thyroid cartilage? Here it is angulated. So it is leaf shaped as well as it is thyroid cartilage is and angulated. The epiglottis was leaf shaped. Next comes the larynx. The larynx in case of the adult, it will be cylindrical. So what about the narrow part? So looking at the narrow part, the narrowest part will be the subglottis. So subglottis is about 70%, and then comes the glottis. So the glottis will be about say 30%. So commenting on the submucosal tissue. So how is the submucosal tissue? The submucosal tissue, it is going to be less. It is going to be less as well as dense. Then looking at the laryngeal cartilage, it will be hard as well as it will be ossified. It will be hard as well as ossified. So this was all about the airway, that is comparing the child and the adult airway. To learn and grow daily like this, please do subscribe.